There we go. Look at that.
Okay. Controller, that little, see if you can move the little arrows, side arrows. Yep, okay, it does look like it is.
So we should be good. All right.
Take it away.
Perfect.
And we're holding our breath.
Okay. My name's Tim Hutchinson. I am the Broomfield County Veterans Service Officer. What does that mean? It means I do not work for the VA. So usually that gets a lot of applause, but I don't work for the VA. What I do is I assist veterans with navigating the different aspects of VA bureaucracy, if you will. So as accredited service, and bear in mind these slides are really to keep me on track, so there's a lot of information on them. Don't worry too much about that. If you ever have a question, you could always just call me. Or 99% of the stuff that's on here is going to be on the va.gov website. You just have to search around a little bit for it. They have a great website. So this is more or less just to keep me on track so that we can go over the important parts, right? So as an accredited Veteran Service Organization representative, I work for the City and County of Broomfield, but underneath the accreditation of the Colorado Division of Veterans Affairs. So we're recognized by the VA as advocates for service members, veterans, and survivors. What can we do? We can assist claimants in filing for VA benefits and services, but we have to be appointed by you to be able to do that in accordance with VA procedures. And that's usually just a simple form that states that, you know, you will allow us to assist you in the claim process. So how we can help. So you have to sign that 2122. We could help you in assist filing a claim or in development of a claim. Sometimes veterans come up and they say, I've been previously denied a claim. I can assist to try to get that claim reopened, to try to get that issue service connected if we can gather the evidence that the VA is going to need to reopen that claim. Usually it's just new and relevant evidence. I can assist you with that, gathering evidence. Service record requests, archives.gov is really where we go for service record requests. They're behind right now, obviously, because of COVID. Everybody's behind, and they have a lot of us scaled down staffing due to this, so they're behind on the service record requests. Corrections of DD-214s, issuance of medals, that's just all going to depend on if it's a simple correction or if it's something major or a discharge issue. And then to help get a copy of your DD-214. So these are the things we're going to look at today real quick. Just the life cycle of a claim, disability compensation, what a service-connected disability is, non-service connected pension, what type of benefit that is, survivor's benefits, and burial benefits. So there's 3 divisions that make up the VA. So you have to make sure you understand that each division doesn't necessarily talk with the other one very much or share information.
Very much.
So you trying to be nice. Right.
At all.
So right. So the issue becomes making sure that you're speaking to the right division for the right purpose, right? Even if you change your address on the healthcare side, you still got to go back to the benefit side and change your address because they're not set up with their computer systems to just have that information go across very easily or at all, to be more precise. So they do the compensation, pension, education benefits, home loan guarantees. They changed the name of Voc Rehab and Employment, but it's still VR&E. Life insurance, and the VA regional office, so down on Van Gordon Street is the regional office for the VA. So if you have to go down there, a lot of people know that when you try to get license plates and the Department of Motor Vehicles says, well, say disabled veteran license plates, you go to the Colorado Department of Motor Vehicles and they say, this letter's no good, we need a letter. Then they usually have, if it's in Broomfield, they'll have them call me. But if you go down to the regional office on Van Gordon and you ask them for all of your state benefit letters, they'll print them out right there for you. So
they also give you to the.
Yeah.
Right to my name.
Yep, they'll print them right there, but all your state benefit letters. So if you qualify for small game hunting and fishing, say, or the property tax, if you're at 100%, all the different things that you can qualify for, they will print those letters out right there. It just, if you go into eBenefits or va.gov and you print those letters, those will not work. Simple fact is it's a state benefit and there's certain criteria, and the federal VA does not alter those letters for the state criteria. However, the regional office understands this, and they do change the language a little bit for those letters so that you can get the state benefits, because they are obviously specific to each state. The cemetery administration, right? So you have national and state veteran cemeteries. They give the support to the state veteran cemeteries. They issue the headstones and markers and presidential memorial certificates, right? So there's certain steps to go through when it comes to getting any type of burial benefits. Scheduling a burial, you can call directly. Normally, if anyone is working with a funeral director, the funeral director will handle all that, including the honor guards, setting up the honor guards, setting up the flag for the next of kin. All that is usually set up through a funeral director. They have a direct 800 number direct to the VA to set those things up, which isn't even in the book that I get. So it's specifically, I mean, if I had to find it, I can eventually find it, but usually it's very tough to find that number.
Can you set that up before you die?
All they'll really do before you pass away is a pre-authorization. They will verify that you're eligible. So it's kind of one of those things where they're just going to say, oh yeah, you're eligible, but you can't really set up a burial or set up these things prior to decease. Yes?
Yeah, does the Broomfield Commons Veterans Section benefit or get anything from the National Cemetery Administration?
Well, if you are a cemetery, so the VA will provide a headstone or marker to pay for the cost of putting that marker into the ground, and you have to deal directly with the cemetery in order to set that up, because someone has to take control of that when it's sent to the cemetery, so they have to authorize it prior to putting the application in. So as far as that goes, yes, as long as the veterans or the cemetery's in the loop and they understand that that's coming, that yes, they can ship those to any private cemetery, and there's no cost for the but the placement, because it's in a private cemetery, falls on the family next to kin.
Last year, there's a group of us, and we were told for a spot cemetery now, because their application to reserve, and they said the VA responded with you get, but it may not be in the state, or you may have to have your body.
So what you did is you the question basically is the pre-planning point. And like I said, when you put in for you're eligible, but here's how you can't reserve a spot. It's going to be right. So it's not necessarily, that's why, right? So
Well, they denied.
Depends if you have a certificate that you have. Is there anyone else buried there prior to someone predeceased here? Wife? So normally, if a spouse or he or she is eligible for burial, and so that would reserve. Obviously, they put that there with them. If you have a Right, but is that may be that you have, doesn't necessarily mean, hey, we have this.
People don't get buried, they get cremated.
Programs there where you can, them scatter them. I'm pretty sure that they have an option where your name can be added to a memorial, even though your ashes are not physically there. Things, but it's not. No. If you go to the VA cemetery website, you could read it right there. It'll tell you they don't reserve spots if you're eligible, being a veteran, if you're eligibility for burial. Okay, so there's a distinction there. Process. What they do is they receive and review your application through their hoops. They're going to send you a letter. They follow all the duty to assist, the evidence you need to be successful, and that's part of the VCAA notice. If they feel that the evidence that they have warrants a compensation and pension examination, they'll schedule that. They'll call you up and say, okay, contract those out. It may not be at the VA. They'll contract that out to a private doctor somewhere, and they'll say, okay, here's your examination for your knee condition or your hearing loss. And then you'll go do that examination, but they don't have to schedule that. If you don't provide them with the evidence and there's no evidence in your service record that you had an event or an injury, right, that may be related to the condition you're claiming, then they are not necessarily obligated to give you an examination. So you have to make sure all of the criteria are covered before they will schedule the examination. If they need to get go after them, and then they'll prepare a decision using all the evidence that they have, your service treatment records, everything, the medical post-service private medical records you sent them. Decision based on all that. And then they'll prepare the award of benefits or disallowance document. And the thing about that is they're going to notify you they approved, what percentage you're at, or why they denied you. If they tell you why they denied you, then you can always, there's steps for appeal. You can file a claim additional evidence. If to this event happen, even though you were never. So you can, and a hearing of given to that. There's a lot of ways to go about a lot of people stop right denial and just stop.
There's also a house hotline.
Yeah.
And I have from a federal judge in DC for me, and he sent it back to the Colorado.
Yeah. Jurisdiction, which
Told me they could send it to wherever they wanted to.
right.
Whatever one.
Yep. So the White House hotline, use it, and they didn't get much. A lot of times they're going to look at it. You still have to jump through the hoop, put in and keep up the time frames. claim is finally adjudicated, they're going to say, well, it's done. You need to restart the process. So it becomes important to try to, to try and keep up with the time frames and make sure that if you need to fight, fight. A lot of times they're not going to grant things. It's not that they're trying to deny you information. Try to get them the information as best as you can and try to get a favorable outcome, right? So then you could file a notice of disagreement. Like I said, well, that changed now that the notice of disagreement is replaced by the supplemental claim, which is good. It's actually a good process because you could file a supplemental claim active date of that claim actually alive. But if you do file for a higher level review, a lot of times what I'll do is conduct veterans. I'll have a discussion with a decision review officer, and I will state why I think they erred, right? It could be the examination. We don't think that the doctor did a good mark another, because your doctor should be part of the record and should be considered evidence. And if you say that you have this condition affects you every day, and they check a box that it affects you once a month. So there's different ways to go. People get sometimes confused, service-connected disability. All I'm going to say about that is does not have to be something while you're on the car act stuff. All really still come to file for this. It's or wartime related. So there's some terms, residuals, right? So when your service record says have acute, that means it's for the VA needs to be chronic. Look at it as a disability. So common cold and flu is an example of that. Disability is long term. Arthritis, migraines, hypertension. You take medication, but it doesn't go away. And then in the line of duty. So if you're someone that's in the reserves or National Guard, the VA doesn't consider that as, even if you're on training. The issue becomes if you get hurt and you get hurt and you have a line of duty in your by that portion of time as active duty. So they can go now because there's a line of duty injury approved in National Guard and the reservists that it's tough to file those type of claims, and they get denied a lot because you have to prove you're an active duty, and if you don't have a line of duty, a lot tougher.
Question.
Yes.
Weekend duty.
Mm-hmm.
You're serving your weekend.
Yep.
And you get hurt.
Mm-hmm.
Then could they change that to an active duty status?
If you have a line of duty determination in there that you through the chain of command and they say yes, in the line of duty, yes, you can go back and if it's something that you got short-term injury and it fine, then no. Chances are, you could file for it, but if it's not chronic, they're going to say it's not a chronic condition.
Since aviators a lot of times
Right.
And it doesn't later.
Mhm.
They may have only been on, you know, active reserve duty
Mhm.
on weekends, but they're flying.
Mhm.
So could you determine that?
Well, a lot of times what they're going to do is look at conducted at that time. Issue with hearing, if you're active duty, they're going to look at your entry, your physical and your separation physicals, and they're going to look at the hearing tests. And if there is no threshold shift with the hearing of, I believe it's or more average for the ones that the VA uses, which is, I think, 1,000, 2,000, 3,000, and 4,000 hertz. If the average is 10 decibels or more, then they're going to consider it and say, yes, that there was a threshold. If there's not, they're going to come. I would say, with regards to that, even talking about the type of noise exposure you had, and then going to an audiologist and see if they'll write an opinion. Because if the VA, once a doctor gives an opinion, that's the book. The only way to come up with the evidence, at least, you know, an equipoise, right? So at least as likely as not 50-50, is to get your own doctor. As long as it's well reasoned and rationale is good, then the judge will look at that and say, okay, the evidence, it opens up benefit of the doubt doctrine because we have two opinions here, and benefit of the doubt goes to the veteran. So there's ways to do it, but I would say if your hearing tests were normal, you could file a claim even if you're in the reserve. You're going to want to try and get a doctor's opinion. Probably after, I would say, the judge can definitely add, because they're more sympathetic than the examiners are for the most part. So service-connected disability, disease, or thing, if you get a waiver to go, you have to show progression of that condition in order to get aggravation. So aggravation is one of the things that gets tougher, but not impossible to show, obviously. But the VA, as to aggravation, or was notated prior. Go ahead.
My grandson had his, went in the Navy, and can he get disability?
Yeah, absolutely. Claim.
I talked with Dylan about that already and
If,
had him do it.
yeah, if it's something that, and you have issues with it today, I would go ahead and I would file for that claim. He's ready to discharge. He has that at his separation physical that he lets them know all that as he's exiting the Navy.
He's already filed for that, for the paperwork and stuff, Rich.
I just want to say that when I was on active duty, it was a constant state of aggravation.
Mm-hmm. This is true.
I just want that on the record.
So noted. So noted. And so compensation, so if you get a 0%, 0% is service connected. That's considered a favorable outcome because as the condition worsens, you can file for an increase for that rating percentage. But a 0% is a favorable opinion because it is service connected and you can seek medical treatment for that condition through the VA. That is service connected. Do charge your insurance or whatever because they do want secondary insurances for anything you're seeing not service connected. But if they do charge your insurance and are billing them for something that's service connected, you want to straighten that out. Make sure they're not doing that. They shouldn't be doing that. Yep.
Back to discharge, what are the other dishonorable discharges?
There is a general discharge. There is Yeah, well, medical is usually under honorable conditions, right? There's other than honorable. There's different discharges. It's just anything than dishonorable, right? So if you get a dishonorable discharge, that pretty much, you know, cuts off the benefits. Even if you don't, if you need it for education benefits, you have to have an honorable discharge. If you don't, if you have an other than honorable or a general discharge, you're not eligible for those medical or education benefits. It has to be an honorable. So it just depends on what benefit you're seeking to what, but it, you know, what discharge that is needed for those benefits. But if you have a dishonorable discharge, then you're not gonna, you know, you're not gonna get anything.
I was always under the impression that an administrative discharge
Mm-hmm.
was not, you could not file for benefits.
Well, it's going to depend, but if it's not dishonorable, an administrative discharge, it's also going to depend on how long, right? If you went in and for some reason you get an administrative discharge and you haven't served 90 days, chances are you're not going to be able to file for benefits because you haven't met that criteria, the 90-day criteria. So there's different things you have to look at to see what benefits you're eligible for.
Dishonorable change to undesirable?
Well, dishonorable is undesirable, but if you wanted to get a dishonorable changed, there's going to be a lot to that. You're only going to get really one chance at that. It's best to get a lawyer because you're only going to get one shot at that.
You don't get the, if you get dishonorable, you don't get the burial benefits.
Yeah, you're not going to get any benefits with a dishonorable, you know. So, which is, I think, you know, it's something you'd want to look at because if you have a dishonorable discharge and the reason behind it is something that should be relooked at, then they can, you know, then you can try to get that upgraded. A lot of things are going to depend on that too. So if it was, you know, 10 years ago and since then you've done great, you haven't gotten any other trouble, you know, you've done volunteer work and people are you know, saying that we think that, you know, he's, you know, a productive, he or she is a productive member of society, then that's going to be the way to try to file for that upgrade. If you've had a couple DUIs since you've been out and been arrested a couple times, I'd say wait a while before you try to upgrade that. It might be a good time to wait. And so then the SMC special monthly compensations are extra pay, dependent on if you're, how bad your disability is, if you're housebound, if you need aid and attendance, different other conditions will grant an SMC. You hear people say that, you know, they're like at 150%. You can only be at 100%. Your pay, that's because a special monthly added to that, that 100%. So if you're getting more than what would normally be there at the 100% rating, what's listed on the VA website, that's because you have additional special monthly compensations, and they usually have a letter and number designation like K1 or something like that. So those are all going to depend on, for special monthly compensations, are really going to depend on what your doctor, you know, what your doctor states on your condition. So there's paperwork for that. Mm-hmm.
These guys that I hang out with on Thursdays,
Mm-hmm.
a couple dozen of us, they said that if you have 100%,
Yeah. Can you hear that?
that if you have 100%, you need to back it up because the VA takes away your disability. And that's happened to several of the guys. They get 100%, and like one guy's a Korean era vet, he's 87, 88, and he had 80%, and they knocked him down to 50 because he filed for the 100%.
Well, here's...
And my best friend from Vietnam,
Right.
same thing. He was 80%. They ran an article about him in the magazine. VA didn't like it, knocked him down to 50. And he's and that was 5-10 years ago.
So let me address that for you. Here's something that you need to keep in mind. If you have a certain percentage and you file for a reconsideration or an increase for that percentage, things that can happen. If you have had that rating locked in for 20 years, there's three things that can happen when they do that. It can go up, it can go down, or it could stay the same. So you're taking a risk whenever you put in for a condition that's already been evaluated. Because if you go in that day and, hey, your range of motion changed just slightly, oh, we're going to knock that down because your range of motion is better than it was on the last exam. So if you file for aid attendance, everything that you have can be reevaluated. If you put in for aid attendance, they're going to reevaluate every condition that you have.
If you file for what?
Aid and attendance.
Home care. Somebody
So aid attendance is you can't, the activities of daily living you need help with, right? So, yep, so housebound. If you file for any of these issues, they can reevaluate every condition, and they will. So that can go up, go down, or stay the same. So it's not they're out there to reduce you. You took a chance when you understand how the process works. When you get reevaluated, it could be a mental health condition, it could be any condition, but you take the risk. So I always tell veterans, what are some of the secondary conditions that we have, right? So diabetes, have you been assessed for neuropathy for the upper and lower extremities? That conditions are not necessarily going to look at the diabetes itself. You're adding conditions to it, secondary conditions related to it. But if you file for an increase, every time you file a claim for something, you don't need to put the conditions you're already service connected for reevaluation, because you're taking that into your own hands right there and saying, okay, or taking it out of your hands and giving it to the VA and saying, okay, reevaluate me. So it can go up, it can go down, it can stay the same. I will say that the VA has gotten a lot better over the years compared to where they were. There's no mass conspiracy of them trying to reduce people. Sometimes you get a future exam date for a condition that you're rated for because they think there's a likelihood of improvement. If you have a surgery and you're rated for that surgery because it's related to a condition, so they give you a temporary, maybe a temporary 100%, they're going to reevaluate that. And you could have been 30% prior to the surgery. They gave you 100% briefly because of rehab or what have you. And then after the surgery, hey, your condition's even better, so we're going to knock it down to 20. So there's a lot of reasons for a reduction. But normally what happens is veterans are trying to get an increased rating, and when they get that increased rating, a new doctor's looking at it, and you're basically putting your rating in the hands of that doctor in that examination, and veterans need to understand that it can go up, it can go down, or it could stay the same. So that's probably what happened there.
For clarification, I want to ask you about it.
Sure.
I have a disability for PTSD.
Mm-hmm.
I broke my back on an injection seat simulator
Mm-hmm.
when I was on active duty,
Mm-hmm.
service connected.
Yep.
And there's x-ray evidence of the fracture in my lower back.
Mm-hmm.
And I have chronic lower back pain that I'm being treated for. But I haven't claimed that. So if I do claim it, see, I never reported it when I was in active duty because I wanted to go to war.
Mm-hmm.
I thought if I had a broken back, they might say no.
Right.
So now if I claim it, do I jeopardize my disability under PTSD?
How long have you had that rating?
The PTSD,
Mm-hmm.
About 3 years.
Okay. So if you don't get that reevaluated and open up, and if it's a static disability and it's not considered an issue that was going to have likelihood of improvement, so there's a future exam date, which is unlikely.
It is.
So the issue becomes, no, you can file for the back and not have to worry about them reevaluating for the PTSD because you're not putting in anything for the PTSD. You're not requesting an increase, so they're not going to look at it.
Okay.
Yep.
So if you have, let's say a 10% disability,
Mm-hmm.
and 40 years later they kick it up to 100%,
Mm-hmm.
are they allowed to knock it down if you file for for something else?
That's gonna depend again. It's gonna depend on,
If you don't file for the PTSD, like.
if you file for, if you do put in for an SMC, they can reevaluate all conditions. So yes, so it's gonna depend on what you're filing for, right? So if someone's to put in for aid and attendance or a housebound or another SMC, they're gonna look at they're gonna put in to make sure all conditions, because you have to be at a certain level before you can file for some of these SMCs. So that's, but if you don't open that up again, they're not gonna come back. The only time they reopen that is if there's a future exam date.
I'm an Agent Orange victim. I had a heart attack at 35 years old.
Right.
Or 37. I had part of a lung taken out at 35. 4 surgeries on the vocal cords and stuff. And it took them over 35 years to acknowledge the Agent Orange caused the heart attack.
Well, they didn't, they weren't, right, but so the issue was when you filed originally, did you originally file for that condition?
I was in the VA when I had the heart attack.
Right, but that's, so.
I filed while I was in ICU.
Right.
They had a DAV guy come in and I signed the paperwork and stuff and they denied it forever.
Right. So the issue becomes once the ischemic heart disease became presumptive for Agent Orange, then they granted it.
Yeah.
Right? Well, you should have, because of what they call NEMR.
They gave me some back.
Okay, so that's what they do then. They go back to when you originally filed. So even though you were denied, you received that retroactive pay from the time that you were originally denied.
35 years.
Well, because they didn't have the scientific evidence to say that all this stuff was related. Now that's why everyone here that was exposed to anything, you should all be on a registry. And here's why. If you file for the Agent Orange registry, right? If you were in Vietnam, they're gonna give you a thorough exam, but they're also gonna track your health over time, conditions that you were having, so that they could say, okay, maybe we got a whole correlation of a data point of this condition from all these guys. Maybe we ought to investigate that and do some scientific studies, right? But the best scientific studies, track people over time. So these Agent Orange registries are really good as far as trying to get some of these conditions that should be presumptive as presumptive. For example, the VA doesn't work fast, right? So there's a bunch of these things that should have been already considered presumptive that they just added, which was bladder cancer, Parkinsonisms, Parkinson-like syndrome, right? And hypogonadism or low testosterone, okay? Those are all now presumptive for Agent Orange, right? But these Agent Orange registries are good at tracking the conditions that the veterans are having and then look at the data points and say, okay, maybe we should study this a little closer. And over time, hopefully they add more conditions to it, right? So again, like the benefit side and the healthcare side are two different animals. Yeah. So, if you filed right away, which was good on you, that's why you got that retroactive pay, right? If they would never have done that study or figured out that, yes, heart disease is related to Agent Orange, you probably still wouldn't have, a service connection. So.
The VA told me it was hereditary.
Right. Well, and there's a lot of things that, that do cause a lot of these conditions.
Well, at the time, my parents and my grandparents on both sides
Right.
were alive, and they told me, oh, it'll skip a generation. I said,
Yeah.
hey, here's proof it didn't skip shit.
Right. So, yeah. So that all being said, I'm glad you're service connected at 100% now. But yeah, sometimes you got to fight, right? So that's the main thing. So yeah.
I just had a lung surgery.
Yeah.
The VA did that.
Mm-hmm.
Should I put a claim for that?
As the VA, so presumption for lung issue. What was the issue?
I had a tumor in my right lung and they removed the tumor.
Cancer.
Was it cancerous?
Cancer,
Yeah, you want to put in. You were in Vietnam.
No, I didn't go to Vietnam.
Oh.
But I was in during the. I was
Okay,
in the Navy.
yeah, so you don't, where were you at? Were you off the coast at all? Do you count?
Yeah, I was in the Navy. I spent time overseas in Mediterranean.
So, if you weren't off the coast of Vietnam, were you?
Brief, not really.
Okay, so then you wouldn't be considered for those presumptions, but take a card and give me a call, we'll have a discussion about that.
Well, he's HVAC,
Yeah, HVAC for sure.
and he breathed all them chemicals.
That's why I'm saying give me a call, we'll discuss how we could approach that. So, let's see. Service connection can be established directly, aggravation of a pre-service disability, presumptively, like we talked about, a lot of them for Agent Orange. Then there's Gulf War, there's, burn pits, there's different things that they're starting to add more presumptions to. Secondary to a service-connected condition, we talked about that, neuropathy due to diabetes, or if you have a back condition, you got the pain shooting down, radiculopathy down the legs, that's secondary to once you get the back condition service-connected, right? There's no time limit ever to apply. And then there's pre-discharge and post-discharge for those getting off of active duty. So there's a lot of ways to establish a claim. So filing a claim, it's pretty easy. 526EZ is the form. Standard claim process, you allow the VA to gather all the evidence. I would give all the evidence to the VA. That's the fully developed claim program. It goes smoother. If they still need something, they'll request it. If they request it, it's not going to kick you out of that fully developed claim pile. If you start sending them unsolicited evidence, they're going to kick it out of that fully developed claim pile. So you want to try and give them as much evidence up front. If they think that they need more, they will let you know in a letter. The VA will always send letters, okay? Unless they're doing an exam, they'll call you usually because it's a contractor. But the VA will send you letters. If you get a call on the phone and they say, this is a VA, and they want you to give your social security number and all that, no, scam it. It's a scam. I'd hang up and call them back and then be on hold. So let's see, intent to file. So 210966, once you file that and say, hey, I'm thinking about filing a claim, you got 365 days to file that, and it will backdate to that effective date when you filed that. If you decide you don't want to file a claim after 365 days, it drops off the books, no harm, no foul. You don't have to file a claim just because you put the intent to file in, but it protects the date of claim. So if you're getting towards the end of the month, you're thinking about filing a claim, you can call the VA up and say, hey, I want to file an intent to file a claim for a service-connected disability, and they'll do that over the phone, and then they'll send you a packet. But that'll protect the date. Non-service connected pension, basically what we need to know about this, it's a needs-based benefit. So you have to meet income guidelines. It's a means-tested income, benefit, right? So there's certain eligibility, but you have to have served at least one day during one of the wartime periods, which are right here. So if you served one day during any of these periods, which I did not, so I don't even qualify for it, thank you very much. But if you did, then you qualify for this benefit. Where this really comes into play, because most people, even their Social Security puts them over income. Where this comes into play is if you or a surviving spouse has to go into an assisted living facility, then all the income, all the money that they pay to that facility is deducted from the countable income. So you're basically underwater because you're paying the facility more than your monthly income tapping into your assets. So this is why this is a good program, because it will stretch those assets out further, because it'll give a monthly benefit amount that will go into the account and help. It won't pay everything, obviously, for a facility. They're not cheap, obviously, but it will definitely help. So they changed it a little bit. The net worth currently is more in line with the Medicaid type of $126,000. That's assets, total assets, plus yearly income. So if you're getting $1,200 a month from Social Security, you know, you figure what, 12, 13, 15,000 or whatever, 15, $16,000 plus all your assets has to come beneath that, and then you could file for it.
That's kind of low, ain't it?
They don't count your house. If someone's living in the house, it doesn't count. They don't count a vehicle. That's stocks, bonds, mutual funds, all that stuff there.
They don't count that on net worth, your house, the value of your house?
Not as long as a family member's living in it. So if someone's living in it, if you sell it, it becomes obviously an asset. It becomes income money, but it becomes an asset in a bank account, right? But if someone's living in a family member or, you know, it's not counted. So that's a good thing. But
On the previous slide, it said something about applicability if you're over age 65.
yeah, they consider you disabled.
Really?
Yeah, when I had
So on the subsequent slide where it talks about net worth
mm-hmm.
and income,
Right.
are you exempt from that test if you're over 65?
No, the net worth testing. That in order you have to be permanent. All these have to take. You have to be conditions other than honorable and 90 days honorable income, and you're permanently and totally disabled or age 65 or older just to qualify for the benefit. They consider, so if you're under age 65 but they consider you P&T disabled, you could qualify. But if you're 65 or older, they consider you pretty much. So
If you're over 65, you're by definition disabled, whether you are.
right. Well, they consider it based on age that
He's
you're.
80 and he rides his bike 25 miles at a time.
Well, there's
You're disabled.
yes, there is certain things. If you ride that for more than 20 miles, then you know they don't consider you disabled. No, they really that's the criteria there. So this applies to everybody that qualifies for it. The income guidelines.
And tell us again what NSC stands for.
Non-service connected. So if it's not a disability, it's a non-service connected pension that's just a needs-based benefit.
Is Social Security considered?
They consider that as income. Yes, they consider everything. So here's just to show you, if you're a veteran with no dependents and you don't have A&A, that's your maximum annual pension rate. MAPR stands for maximum annual pension rate. That means, you know, that if your income's more than that, or if you need aid and attendance and you have no dependents, right? 22,000. If you have one dependent, you have a spouse, that's your max right there. That means if your income is over that, you don't qualify. Say you make 25,000, you're 2,000 under, they'll pay that difference, that 2549 over 12 payments. They'll divide that, and so it's basically based on income of what, you know, if you qualify and what you would receive.
So how often would you have to re-up that every year?
No, once you qualify, you just have to keep them. If there's any changes in your income, you have to let them know.
I have a question on that, VA, on the medical.
Mm-hmm.
If you need any changes to your house, because you're disabled, do they help out?
So we'll get to that a little bit further down, so we can look at that. Pension with aid and attendance. So that's the one I talked about. If you need the help of another person for certain activities of daily living, or you're considered housebound, you can get additional money. For that, there's a form the doctor has to fill out, 212680, that to be submitted to the VA for that. Survivor's pension.
I got a question.
Yeah.
After I got out of the hospital,
Mm-hmm. Mm-hmm.
can I file? So she could
Worker at the VA. Care team, you have a doctor, talk to the social worker and say, hey, we need to get a caregiver program.
Okay, got it, because she's still doing that.
Yeah,
Every time I do the chemotherapy, she comes and stays with me
yeah,
until I get over it.
yeah. So I would contact your social worker and ask them about the caregiver program and see if you meet the qualifications. For surviving spouse, it's even way less, right? So 14,000 is usually if they need 8 to 10, it's less than $15,000. Like I said, it's not a big benefit, but that goes a long way if they're upside underwater when they're paying a facility. You know, all that money helps to stretch the assets out until, you know, till they're gone, or until it can turn over into maybe when all the income's gone, then it could go to Medicaid, you know, apply for the Medicaid and go from there. So dependent indemnity compensation. So if a veteran passes from a service-connected disability, the surviving spouse can file a dependency indemnity compensation claim to get a monthly benefit from the VA. Okay, so there's a lot of criteria to the program, but the service connection does not have to have been established before death. Okay, that's the key thing. If the veteran was fine and then passed away from something that's considered presumptive for Agent Orange, they can file for that to be service connected to get her the benefit. Doesn't matter how long ago that was. So, you know, their spouse could have died 25 years ago from a heart, you know, coronary artery disease and a heart attack. They can file for that. They're not going to get all that money back 25 years ago, but moving forward, they'll get a monthly benefit if it's approved. Long-term care. So a lot of questions come up about long-term care programs. Highest priority Veterans First for any of the state and community living centers that are here in Colorado. If you're 70% service connected or higher, you get priority, right? The cost of care is usually covered, you know, or if the service connected disability is a reason for needing care. It's usually covered, but I would say there's a form, this one here, they're always changing these, right? So spouses and Gold Star mothers, you know, it's a private pay. The VA is not going to pay for that. So private pay, Medicaid, or long-term care insurance, it's pretty expensive for a spouse. At Fitzsimmons, that was the last time I called. And $7,500 for those less than 70%. But there's a form here you could always fill out, send it to them, and they will tell you what your responsibility is. So if there's a copay involved, or if they say no, it's no cost, or if they just take that money that you would get from that and you don't have to pay because they take whatever your service connected amount is. But that changes so often I don't even keep up with it, because the best thing to do is call the facility directly. They have people that are there that can answer all of those questions. Burial benefits. There's the number to schedule them, right? So you have a state veteran cemetery in Grand Junction. Obviously, we got, you know, the Fort Logan. I know they're building several of them. So there's going to be state cemeteries that are pretty nice too. So the national cemetery is one, the state cemeteries are another. Like we talked about before, they'll do the headstones, markers, medallions, burial flags, the military honors, and so
You told me that you had to pay
for what?
for say like you die and you have the Navy come and do the honor guard
No.
and all that?
No, that's part of the whole. You just call that, the funeral director would normally call that branch and set that up. So it doesn't have to be. It could be anywhere. So if you're at a funeral home, I've seen Marines come to the funeral home to fold flags and what have you. And so it doesn't necessarily have to be at the cemetery. If someone's last wishes are to be cremated and spread somewhere, and they're doing it all at one shot at at a funeral home, they'll come there. You just the funeral director just has to set it up. And they usually will play taps as well if they have someone that's available to play taps.
Yeah, like, you know, for example, when my wife passed away, we had a memorial service at Holy Comforter Church, which is Episcopalian Church
Yep.
right here. The military honors, they came right there.
Yep.
And presented the flag and did the,
So you don't have
Yep.
to go to the cemetery.
No, they'll
He
come.
was a retired naval
Yeah,
officer, so
yeah.
that may be a different situation.
Well, no, they usually will come to wherever, you know, and do the presentation of the flag to the next kin.
My dad was a World War II vet, and when he died, we still have one plot at Mount Olivet. And we had to pay a private group to come out there and do the services, the flag and the folding and all that. They didn't have military people there like they did at Fort Logan, like they do at Fort Logan. We had to pay a group of guys like this, older people, that went and did the ceremony there.
Yeah, I don't know why that is. Couldn't answer to that.
Well, we hosted two little memorial services right here in this room for 2 World War II veterans, and they arranged for the flag folding and everything to come right here to do
Yep.
it.
That's what they'll normally do. John?
Correct me if I'm wrong, but now the services don't do a three-volley salute. They only do the flag folding, the taps, and the presentation of the flag.
Yeah, the type of honor guard that is provided is going to depend on the benefit that you know, based on, you know, like you said, retired naval officer is one thing, right? The type of benefits there is going to be something that's figured out when they look at the DD 214, look at service and say, you know, if there's a certain medal there, right? Someone has a Medal of Honor, obviously they're going to get a little different scenario than someone that doesn't. So it's all just going to depend on what they do. But normally, yes, they don't do any gun volley at all. Normally, you would want to reach out to like the American Legion or, you know.
Bring that up.
Yeah, absolutely.
Legion of the VFW.
Which is usually, yeah, which is usually what I tell, you know, veterans that are calling about that information to reach out to, because sometimes I get calls and they may be from, you know, Grand Junction. If for some reason they're calling me. So, but I'll tell them, yeah, but I'll tell them the same thing. Hey, here's, you know, reach out to your local American Legion there, or I just have them call department, you know, and have the department tell them, you know, who to contact to get that done. Burial cost reimbursements. It has to be service-connected death, or you have to be service-connected as a veteran before they're going to pay any burial reimbursements, right? If you're a veteran and you don't have any service connection, you pass away and you file for a burial reimbursement, they're not going to pay it because you don't meet the criteria. You have to have a service-connected disability in order to qualify for any of these, right? So if you're
The grave I got, they said that they would pay for the vault, they'd pay for digging up the grave, but they wouldn't pay for the casket or the...
But
So if I die of a heart attack because I have a disability for ischemic heart disease, I'm eligible for this?
you're eligible for, if you die, yeah, if it's a service-related death, then you should qualify for that. A reimbursement to, it has to be something that someone is eligible to get, surviving spouse, right?
So with ischemic heart disease, I die of a heart attack, I'm eligible.
Yeah, because it's related to your condition.
So I have to...
So it's service connected. So, but it's got to state that, you know, it's got to be on your death certificate. And that, well, just yeah, what is this major contributing factor as well? So if they say coronary artery disease is a major contributing factor, you know, you're covered. But, you know, heart attack usually is good enough to say, hey, this is related to my service connected condition, right? So yeah, $2,000 to the next of kin. Normally that's processed depending on how long you've been at 100%. If you're at 100% for 10 years or more, that's automatic. They don't even have to, if you're 100% for 10 years or more, they're going to pay that right away once you're reported deceased. They're also going to do the dependent indemnity compensation claim automatically if you've been 100% for more than 10 years. If it's a non-service related death, then $300, and if you get your own plot, you'll get up to $745.
My niece, my brother just died. He had diabetes and dementia. He's a Vietnam veteran. Diabetes is covered by Agent Orange. So he's eligible for this $300. Is eligible?
No, your niece isn't considered the daughter isn't considered. It's the next of kin. If your daughter was
He's
his,
only next to kin. He didn't have a wife.
yeah, then it has to be someone who is qualified, dependent.
Oh,
Okay, so the only time someone of an older is going to be considered as a dependent if they were permanently and totally disabled before the age of 18 and were considered dependent on that person's claim. The only person that's going to be eligible is a person who's a dependent, considered a dependent in the VA's eyes. They're not just going to, to a daughter or to someone. But if they're considered a dependent for VA purposes, then yes. So it doesn't, that's the main stipulation on that. It has to be someone who's eligible in the VA's thing. So in the VA's eyes. So the VA healthcare enrollment, talk about this because a lot of times I get calls from veterans who are older, and the issue is they've had a health setback and they want to know if they're eligible for someone to come into the home, all this stuff. And it's like, well, if you're eligible, if you are receiving VA health care, then you want to go to to the social worker or to the primary care doctor and discuss with them the needs. If you're not in the VA healthcare system and setback, and now because it's a veteran, they want the VA to be able to provide services, they're not going to just provide the services unless you're enrolled in VA healthcare. So I always advise everybody to get enrolled in VA healthcare to see if they can meet the criteria. Not everyone can, because you have to have a service-connected disability or you're receiving pension benefits, which means you meet the income criteria. And right now, the gross household income, I think in the Broomfield area, is about $55,000 a year for gross household income to be able to meet the income criteria, right? They will allow veterans that are exposed to Agent Orange, certain toxic exposures like Agent Orange, the Gulf War, and burn pits. Because you are eligible for registry, you're also usually eligible to get VA health care benefits. And then, of course, recently discharged veterans, you get a year. If you're a combat veteran, recently discharged, you get 5 years on VA health care. That being said, if you're a veteran that's recently discharged, there's possibility you should be filing for a claim if you have any issues, because you have 1 year from your date of discharge to file a claim, and for it to go back to the date of discharge. 366 days later, it becomes harder because there's a lot of conditions that they're going to consider presumptive from that 365 days of discharge. If you have a knee condition, your knee's locking up, well, chances are good it's related to service because it's, you're filing it within 6 months or a year of discharge. It's going to be a little easier to service connect. Outside that year, you're going to need more and more evidence to be able to get that service connected. Yes?
So if you've applied for VA healthcare,
Yes.
but you don't meet any of those criteria, are you still carried on the books as having applied for future?
So yeah, they would send you a letter, right? If you don't receive a letter, you need to call them up and say, hey, I applied for health care, I haven't got a response. They will send you a letter saying, hey, you're denied, here's why. Yes, you will be on the books, but as of having applied. If that criteria changes as to why they denied you, reapply. You can reapply, right? So it's just all going to depend on, you know, the reasons for denial. They should have a record of it, but you know, you got to reapply anyway. So, you know, it's just a matter of putting that in we all know that your VA file is only, you know, a little thin file that, you know, you don't have much paperwork in, right? Right? You got a whole filing cabinet for your VA paperwork. I would keep everything, all correspondence, everything you submit to the VA and everything you receive from the VA. I'm working with a veteran now who a lot of his claim file disappeared. And they keep asking for stuff like his very first rating decision that he received. They don't have a copy of it. And he's gone to the Court of Appeals, the Board of Appeals, and he's still, since 2006, he's been fighting this. And it shouldn't, you know, shouldn't be like that. But, you know, if you're working with someone, a veteran service organization, or you're working with someone, make a copy for them. Keep an original. Don't give them your originals.
Does that include prescriptions they give you too? Should you keep all that stuff?
That's medical. I'm talking disability. All the medical stuff you should be able to find. Anything disability related that you're filing for disability, I would keep everything that you give, everything you receive. Yeah. It can help you out in the long run. So urgent care facilities. If you have VA health care, you can get access to VA urgent care in network. What does that mean? Well, there's a facility locator right there, right? So can we click on that link real quick? Is it opening? Well, anyhow, I think it's open there, but it's not showing here. Mike, is there a way to switch that over here or no?
Not that I'm aware of.
All right, we're good. So anyway, the VA has a facility locator, right? If you go to va.gov and put in the search bar urgent care, you know, or you call the VA and say, hey, you know, the healthcare side, you call the hospital and say, hey, where's the urgent care near me, right? There's different contracted facilities that will do VA urgent care. You get 3 free visits a year. After that, it's $30 a visit. The facility will never charge you. If they ask you for money, tell them no, the VA is going to take care of it. If the VA feels that you need to pay, the VA will bill you, okay? So you never have to pay any money at the urgent care facility. I got a scratchy throat, you know, I'm not feeling good. Rather than going all the way out to the VA, go to an urgent care facility if you're in VA healthcare. And like I said, they're easy to find, or you can always call me and I'll look it up for you. If I'm in the office or I'm available, I'll look it up for you if you don't have access to the internet. But that is a great benefit that's part of VA healthcare. So you don't have to go all the way to the VA if you're not feeling good. So this was the latest COVID information, but they change the information all the time. But if you go to the va.gov page, the very first page is going to have a box that has the latest COVID. You just click on that link, it'll take you there. Yes, the VA is now doing ages 70 above.
65.
Did they drop it to 65?
I got my shot last Wednesday.
Right.
And they dropped it to 65 Monday.
Okay. They need to update their website. Because I looked at it this morning and it says 70. I know a couple weeks ago it was still 75, but now it says 70. If they move to 65, great, but you have to make an appointment. It's like anywhere else.
If you call the nurse, you call the VA, press 3.
Yep.
Press 3 again to get to the nurse.
Yep.
If you listen to all that shit beforehand, it'll tell you 70 and up.
Yep.
You get to the nurse will tell you 65.
Yep. So
Their pre-recorded shit says 70.
right. So the issue becomes making sure that you call and get an appointment. Nobody's doing shots without appointments right now. So you have to get an appointment, whether you're going to go through your private care, Kaiser, or, you know, whatever you have. If you're going to go through the VA, the City and County of Broomfield website has links that you can go to, and actually I think the count through the state, it will take you to that new UC hospital that's up there right at the Boulder Turnpike and 287 there. So there's that hospital there. I think there you could get on a waiting list to get shots there. Yeah, there's a lot of places that you can get on the waiting list for Denver Health.
They'll give you a shot record.
Yep.
And they'll tell you to download it in your phone.
Yep.
And if you're gonna fly, you show your shot record and stuff that you got it.
Yep.
They'll give it to you.
Yep. So as far as the COVID stuff goes, everything's still by appointment. So you got to deal with the VA, go through your primary care, the nurse, like you said, you call up and you say you want to get on the, everyone's got to wait. I know everybody wants to get it now, or most people want to get it now, those that want to get it, but the issue becomes it's the government.
See, and I had lung cancer,
Mm-hmm.
they called me twice.
Right. Those that are more susceptible and have conditions, because you're doing chemotherapy, you have the weakened immune system and all that, they're going to probably prioritize. There's different priority groups for this. So you fall into that priority group and then go from there. The other important thing is the VA caregiver program that we discussed, right? You can go to the va.gov site and type in caregiver. They've expanded the program. It was just for post 9/11 veterans. Now they've opened it up and they're starting to get it more on track, but that has to go through your primary care or your social worker is the best contact to start that up. That's the key there. There's the phone, the VA phone number. Now to go back to your question about home, say home alterations for people that have disabilities. The VA will put on your rating decision if you qualify for any type of home or vehicle adaptation grants. That will be right on your rating decision. It'll tell you if you qualify or not, based on your disability that you have and based on all the evidence of record at the VA. If you feel that you should deserve it and you don't have it, because the criteria is pretty strict as far as the criteria for that, for those benefits, those, the vehicle adaptation and the house adaptation grants. Now there's another one that's a little less stringent that you could put in for, which is a HISA grant, and those are just a certain amount for small modifications of the house. You could put in for those. You don't necessarily, they're going to just tell you yes or no. And you can still appeal all those, right? So if you feel that you should have that HISA grant because you need to modify something up to the amount that grant qualifies for and they deny it, you can appeal it and say, hey, this is why I think I need it. So you can still appeal those denials, right? Everything has a due process with the VA. Even if they're going to reduce you, they have to send you a letter. And there's due process to that. If they're going to reduce you and they give you that letter, you request a hearing within 30 days, that's going to stop that reduction until you meet with someone and discuss that. So there's a lot of information as far as how to go about that. So that being said, does anybody have any other questions?
Yeah, Tim, one question I have. Going back to getting the COVID vaccination, the impression I got from your comments, it's better for the veteran, let's say in Broomfield, to apply through whatever websites, the Broomfield government lists and others, versus trying to go to the VA to get the.
Well, it's going to be based on a number of things, right? How far do you want to travel to get the vaccination? The VA has criteria, and you have to do them in the places that they're going to give them, and they have their waiting list. City and County of Broomfield on their website has information. You go to the City and County website, there's going to be links that you'll be able to click through to get you to somewhere that may be a waiting list that's a little more local, right? So The state also has their, you know, their places they're giving them, right? So it's going to depend on if you want to travel or if you want to get it as fast as possible, or, you know, because the VA, some people think, well, you know, I have all these health conditions, I need this. Well, when you call the VA for that appointment, you need to let them know, hey, I'm rated at 100%. I have a lot of issues. You know, do I meet one of the criteria where I can get in sooner than you know, than it's available? So they, you know, it's all going to depend on their criteria. But the county website and which also has a link that goes to the state, which if you click on that, what came up to someone, because they called and I looked it up for them and I said, hey, because they said they were on a waiting list at the VA, they've been on a waiting list. I go, well, here's a number to call to get on the waiting list that's close to home, if you so want to do that. I don't know what, you know, the time frames are, you know, what they are. So everyone has to abide by the time frames, because we can't change that. But you know, I talk to many people and they're on, you know, 3 different lists or whatever, and I get it. But you know, then the issue is when they call you for that shot, whichever the first one is, make sure you go and cancel the other 2 that you were on and say, hey, I know, because then that, you know, it saves time. Then cancel you off. So those things where depending on, you know, whichever one is going to be more convenient, right? Because that's obviously the closest one I found. So it's going to depend. There's a lot of information out there. You could go through the VA. You can go through the state website. You know, any site you sign on to is good. Something about COVID on there that you click on, it'll take you to the information you need. But the vaccinations, I think that it's going to be an ongoing thing until obviously through the summer, until all those that want them have them.
Till you either get herd vaccinations there, or herd immunity,
Right.
or the rest of them die. One of the two.
Yeah. Well, we'll get to where we're going to be, you know, sometime. I'm just hoping things get a little more normal sometime soon. So, anybody else? So that's the number for the VA for the benefits. Any benefits questions ever? Even if you want to contact the regional office, that's the number to get to, believe it or not, to Lakewood, because you tell them where you're at and who you want to talk to, and they'll transfer you to Lakewood.
Every time I call that number in San Francisco.
Well, they have a call center in different areas, so, but they will get you to who you need to, once you give them the information. They're pretty good. I mean, as best as, you know, they can do anyway, so.
And don't go through anybody that's charging you. Go through these guys. I fucked up and did that, and Connecticut, ALPA, signed a damn contract with this clown. Wouldn't do a damn thing, didn't put in any paperwork, bitched at me for putting in paperwork, and then told me, well, I'm only trying to get you 70%, and then we'll go for 100%. And this guy had 10 years and got 20%, and he got $8,000.
So that's a good warning for everybody.
Yeah.
When I first started, I went to Tim Worth, Pat Schroeder, Pearl Mutter. All of them denied me help. None of them looked up any information. I had to get all my own medical records, everything, and submit them. And then this clown that was getting 20% didn't want me to do that because he could stretch out and get more money in the long run. So go through the VFW, the DAV, American Legion, anybody except a private guy.
Yep, counties, most counties have VSOs, and of course the state of Colorado has VSOs too, so.
Yeah.
But, so I have cards over there. If anyone has questions, you could always call me. If I don't answer, I'll get back to you. I'm still working remotely from home for the most part, and until we'll figure out if that's gonna transition to back in the office in June. But regardless, I'm still able to meet with you and do whatever we need to do claims, do whatever we gotta do. So feel free to give me a call for anything, any questions you might have.
I have a personal question. I was in combat. I was 50 miles from Cambodia.
Mm-hmm.
And I seen combat. But my company wasn't authorized combat